Heatstroke in the elderly is a critical health concern that requires immediate attention. As our loved ones age, their bodies become less equipped to regulate temperature effectively, making them more susceptible to heat-related illnesses. It is vital to address this issue and take necessary measures to protect their well-being. The seriousness of heatstroke in the elderly cannot be overstated. Heatstroke occurs when the body's internal temperature rises dangerously high, putting immense strain on vital organs and potentially leading to life-threatening complications. This condition demands prompt action as it can rapidly progress and cause severe harm if left untreated. Now, let's explore how we can effectively deal with heatstroke in the elderly. By understanding its causes, recognizing its signs and symptoms, implementing preventive strategies, and knowing how to respond correctly during an episode of heatstroke, we can ensure the safety and health of our aging loved ones. Understanding heatstroke. Heatstroke is a severe condition that occurs when the body overheats due to prolonged exposure to high temperatures or physical exertion in hot weather. It is essential to understand the causes and risk factors associated with heatstroke, particularly in elderly individuals who are more vulnerable to its effects. As we age, our bodies become less efficient at regulating temperature, making older adults more susceptible to heat-related illnesses. Factors such as reduced sweat production, decreased circulation, and certain medications can impair an older person's ability to cool down effectively. Recognizing the signs and symptoms of heatstroke is crucial for timely intervention. Common indicators include a high body temperature, usually above 103 degrees Fahrenheit or 39.4 degrees Celsius, altered mental state or behavior, such as confusion or agitation, rapid breathing, flushed skin, headache, nausea, dizziness, and even loss of consciousness. To prevent heatstroke in the elderly population, it is essential to stay informed about potential risk factors. Encourage loved ones and caregivers always to be vigilant during hot weather conditions and take necessary precautions. By understanding the unique risks faced by older adults regarding heatstroke and recognizing its signs early on, we can ensure prompt action and avoid severe complications that may arise from this dangerous condition. Prevention is key. Heatstroke in the elderly can be a life-threatening condition, making prevention essential. By taking proactive measures, we can significantly reduce the risk of heatstroke and ensure the well-being of our loved ones. Staying hydrated and avoiding prolonged exposure to heat. One of the most effective ways to prevent heatstroke in the elderly is by staying hydrated. Encourage your loved one to drink plenty of fluids throughout the day, especially during hot weather or when engaging in physical activity. In addition to hydration, it's crucial to limit exposure to extreme heat. Advise your loved one to stay indoors during peak hours when temperatures are highest. If venturing outside is necessary, recommend doing so early in the morning or later in the evening when it's cooler. Maintaining a cool and comfortable environment. Creating a cool and comfortable living environment plays a pivotal role in preventing heat-related illnesses. Ensure that their home is properly ventilated with fans or air conditioning units. If access to these amenities is limited, suggest alternative cooling methods such as using wet towels or placing ice packs on pulse points. Encourage them to wear loose-fitting and lightweight clothing made from breathable fabrics like cotton. Additionally, remind them to use sunscreen and wear hats or carry umbrellas when outdoors for added protection against harmful UV rays. By implementing these preventive measures consistently, we can greatly reduce the risk of heatstroking seniors while promoting their overall well-being. Identifying and responding to heatstroke. Heatstroke can be a life-threatening emergency, especially for the elderly. It is crucial to recognize the signs and symptoms of heatstroke promptly in order to take immediate action. The first step in identifying heatstroke is understanding its key indicators. Look out for high body temperature, typically above 104 degrees Fahrenheit, 40 degrees Celsius, along with hot, red, and dry skin. Other common symptoms include headache, rapid heartbeat, dizziness or lightheadedness, nausea or vomiting, confusion or disorientation, and even loss of consciousness. If you suspect someone may be suffering from heatstroke, it's essential to act swiftly. Start by moving them to a cool and shaded area away from direct sunlight. Encourage them to lie down if possible. Remove any excess clothing and use a fan or wet towels to help lower their body temperature. Next, call for medical assistance immediately. Heatstroke requires professional attention as soon as possible due to its potential severity. While waiting for medical professionals to arrive on the scene or during transportation to the hospital, continue efforts to cool down the individual using cold compresses on their forehead, neck, armpits, or groin areas. It's important not to offer fluids if the person is unconscious or experiencing seizures, since they may have difficulty swallowing properly at this stage. However, if conscious, encourage them drink small sips of water while taking care not overhydrate. Remember that time plays a critical role when dealing with heat stroke. Delay can worsen the condition rapidly, leading complications such as organ failure, which could potentially result in death. By recognizing these signs promptly and taking immediate action, including calling emergency services, you can significantly improve outcomes when responding effectively during an episode of heat stroke in elderly individuals. Tips for managing heat stroke in the elderly. To effectively deal with heat stroke in the elderly, prevention plays a crucial role. By taking proactive measures, we can significantly reduce the risk of heat-related illnesses. Here are some key strategies to keep in mind. Staying hydrated and avoiding prolonged exposure to heat. One of the fundamental aspects of preventing heat stroke in the elderly is ensuring proper hydration. Encourage your loved ones to drink plenty of fluids throughout the day, especially water and electrolyte-rich beverages. Remind them to sip on liquids even when they don't feel thirsty. Additionally, it's essential to avoid prolonged exposure to extreme heat. Encourage your loved ones to stay indoors during peak hours when temperatures are at their highest. If they need to go outside, advise them to wear light-colored and loose-fitting clothing that allows air circulation. Maintaining a cool and comfortable environment. Creating a cool and comfortable environment for seniors is vital in preventing heat stroke. Ensure that their living spaces are well ventilated with fans or air conditioning systems functioning optimally. Furthermore, consider implementing additional cooling techniques such as using shades or curtains to block out direct sunlight from windows, or setting up portable fans strategically around the house. Encourage your loved ones to spend time in cooler areas within their homes during hot weather conditions. This could include staying in air-conditioned rooms, sitting near open windows where there is a breeze, or even utilizing basement areas if available. By prioritizing these preventive measures, staying hydrated, avoiding prolonged heat exposure, and maintaining a cool environment, we can significantly reduce the risk of heat stroke among older individuals. Identifying and responding to heat stroke. Recognizing the signs of heat stroke is crucial in order to act promptly and effectively when encountering someone who may be experiencing this condition. Heat stroke occurs when the body's temperature regulation system fails, usually as a result of prolonged exposure to high temperatures or physical exertion in hot conditions. The signs of heat stroke can vary, but some common symptoms include high body temperature, above 103 degrees Fahrenheit or 39.4 degrees Celsius, hot, dry skin, rapid heartbeat, headache, dizziness or lightheadedness, nausea or vomiting, muscle cramps. If you suspect that someone may be suffering from heat stroke, it is important to take immediate action to prevent further complications. Here are the steps you should follow. Move the person to a cool and shaded area. It is essential to remove them from direct sunlight and into a cooler environment as soon as possible. If available, an air-conditioned room would be ideal. Call for medical help. Contact emergency services right away if you notice any severe symptoms such as confusion, seizures, difficulty breathing, or loss of consciousness. Lower their body temperature. While waiting for medical assistance to arrive, you can help lower their body temperature by applying cool water on their skin using wet towels or spraying mist over their body with a spray bottle. Provide adequate hydration. Offer small sips of water if they are conscious and able to swallow safely. It cannot be stressed enough how important it is to seek medical help without delay when dealing with heat stroke cases. Only healthcare professionals will have the necessary expertise and equipment to provide appropriate treatment for this potentially life-threatening condition. Additionally, while waiting for medical help to arrive, providing first aid measures such as cooling the person down can make a significant difference in improving their chances of recovery. Remember that every second counts when it comes to heat stroke, so recognizing the signs and taking immediate action is crucial. By being aware of these steps and informing others about them, we can contribute to saving lives and ensuring the well-being of those at risk. Tips for managing heat stroke in the elderly. When it comes to managing heat stroke in the elderly, there are several practical strategies that can help ensure their well-being during hot weather. These strategies focus on regular checkups, medication management, and the crucial role of caregivers. Regular checkups play a vital role in identifying any underlying health conditions that may increase the risk of heat stroke. It is essential for healthcare professionals to monitor medications and adjust dosages if necessary, as some medications can affect the body's ability to regulate temperature or increase sensitivity to heat. By attending routine appointments, elderly individuals can receive personalized guidance on how to stay safe during summer months. Medication management is another key aspect of dealing with heat stroke in the elderly. Caregivers should be diligent in ensuring that prescribed medications are taken properly and at the appropriate times. Some medications may require adjustments during hot weather, so it's crucial for caregivers to stay informed about any potential side effects related to heat exposure. Caregivers play a significant role in safeguarding the well-being of elderly individuals during hot weather. They should regularly check on their loved ones' hydration levels and encourage them to drink plenty of fluids throughout the day. Additionally, caregivers should create a cool and comfortable environment by utilizing fans or air conditioning systems and keeping curtains closed during peak sunlight hours. By following these practical tips for managing heat stroke in the elderly, we can significantly reduce the risk associated with high temperatures. Regular checkups and proper medication management coupled with attentive caregiving will help ensure our loved ones' safety when faced with extreme heat conditions. Conclusion: heat stroke in the elderly is a serious issue that requires immediate attention. Throughout this video, we have explored its causes, risks, prevention strategies, and ways to effectively manage this condition. By understanding what heat stroke is, recognizing its signs promptly, implementing preventive measures consistently, managing medication effectively under professional guidance, and providing attentive care when needed, we can significantly reduce the risk of heat stroke among older individuals. Let us stand together in raising awareness about this critical issue. Share this information widely so that others too may become aware of how they too can effectively deal with heat stroke in the elderly population. With our collective efforts, we can protect our vulnerable seniors from the dangers of heat stroke and ensure their well-being. Remember, by being proactive and informed, we can effectively deal with heat stroke in the elderly. Stay cool, stay safe,